Join me as I take on the challenge of figuring out if I'm vitamin B12 deficient. I'll be testing my levels and sharing my journey along the way. Vitamin B12 plays a crucial role in our overall health and wellness. It's essential for the production of red blood cells, nerve function, and DNA synthesis. Without sufficient vitamin B12, our bodies can't function properly, leading to a range of health issues. One of the most common signs of vitamin B12 deficiency is fatigue. If you're constantly feeling tired, even after a good night's sleep, it could be a sign that your body is lacking in vitamin B12. Another symptom is weakness in the muscles, which can make everyday activities feel like a chore. You might also experience numbness or tingling in your hands and feet, which can be quite uncomfortable. Additionally, some people may experience shortness of breath, which can be a bit alarming. As I mentioned earlier, fatigue is a major one, but it's not the only symptom. You might also notice changes in your mood, such as depression or anxiety. These symptoms can be subtle, but it's essential to pay attention to your body and recognize when something's not right. Brain fog is another symptom which can affect your concentration and memory. This can be frustrating, especially if you're used to being sharp and focused. Digestive issues are also common in people with vitamin B12 deficiency. You might experience diarrhea or constipation, which can be uncomfortable and disrupt your daily life. Some people may also notice that their skin, hair, and nails are affected, appearing pale, dry, or brittle. These symptoms can be a bit vague, but if you're experiencing several of them, it might be worth investigating further. So, what causes vitamin B12 deficiency? For vegans and vegetarians, it can be a challenge to get enough vitamin B12 from plant-based sources, as it's primarily found in animal products. Even if you're eating a balanced diet, you might still be at risk if you're not consuming enough vitamin B12-rich foods. Certain medications such as proton pump inhibitors and metformin can also interfere with vitamin B12 absorption. For example, if you're taking medication for acid reflux, you might need to pay closer attention to your vitamin B12 levels. As we age, our ability to absorb vitamin B12 decreases, making older adults more susceptible to deficiency. This is especially true for people over 60 years old. Additionally, people with gastrointestinal disorders, such as celiac disease or Crohn's disease, may have impaired vitamin B12 absorption. This can be a bit tricky to manage, but it's essential to work with your healthcare provider to find a solution. If left untreated, vitamin B12 deficiency can have serious health consequences. It can lead to anemia, which can cause fatigue, weakness, and shortness of breath. Untreated deficiency can also cause nerve damage, leading to numbness, tingling, and pain in the hands and feet. This can be a bit scary, but the good news is that it's treatable. In severe cases, untreated vitamin B12 deficiency can increase the risk of heart disease, as it can lead to elevated homocysteine levels. High homocysteine levels are associated with an increased risk of heart attacks, strokes, and other cardiovascular events. This is a big deal, and it's essential to take it seriously. Let's recap. Vitamin B12 deficiency can cause fatigue, weakness, numbness, and digestive issues, among other symptoms. It can be caused by dietary factors, absorption issues, and age-related changes. If left untreated, it can lead to serious health consequences, including anemia, nerve damage, and heart disease. If you've made it this far, I want to hear from you. Have you experienced any symptoms of vitamin B12 deficiency? Share your stories in the comments below. If you're interested in learning more about nutrition and wellness, be sure to check out my other video on the benefits of omega-3 fatty acids.